Good afternoon. Thank you for joining us. My name is Brad Woodhouse. I'm the Executive Director of Protect Our Care. We are here one day before the final vote is taken. Final votes are taken in this election. Of course, people are already voting. As I think anyone who's followed this closely knows, this is a healthcare election, and we're here today to talk about healthcare being on the line for the American people in this election, very much like it was in 2018. And we're so honored to be joined by Speaker Pelosi. Good afternoon, Madam Speaker. Thank you for joining us. We are just getting started. I know you see on your screen the Storytellers. As my good friend and someone you know well, Adam Hoyer, says often, the most effective thing we have in politics and in advocacy is good storytelling. And in fact, I think reflecting back on where we were 10 years ago, Madam Speaker, when we were trying to get this passed, and in the months after we got this passed, the storytelling was really so important. And it was one thing that, Republicans, including Donald Trump, have never had. I mean, they cast aspersions on the Affordable Care Act without evidence. They cast aspersions on the work that we're doing to improve American health care without evidence. And they have been at it for 10 years. I think you predicted 10 years ago that this law would help the American people. It would provide coverage. It would provide protections. It would extend a level playing field to women. It would help young people. It would lower the cost of prescription drugs for seniors. And it would do all of those things. And by God, one day it would be more popular later than it was then. And of course, over the years, we've gone through some rough patches politically, but now things are different. And the one thing that hasn't changed, though, is that Republicans continue a war on American health care. They've done it legislatively, and now they are doing it in the courts. And I think, as everyone knows, 1 week from Election Day tomorrow, on November 10th, the Supreme Court is going to take up a case that could invalidate the entire Affordable Care Act. And the best thing we can do to prevent that from happening is to send the loudest political message that we can tomorrow. And that is to return Speaker Pelosi to the Speaker's chair with an expanded majority, to put Democrats in charge of the United States Senate, and to elect Joe Biden President of the United States. So that's the message we're trying to get out today. We have storytellers, Madam Speaker, from around the country. Won't be surprised they come from key battleground states, but the most important thing is that their stories are reflective of what's at stake in this election. And so I want you to hear from them, but at first, we'd like to hear from you. You are, as I've told you before, you are Speaker ACA, but more than that, you are Speaker Healthcare. What you have done, particularly this cycle, but going back many years, but this cycle, this Congress, efforts to enhance the Affordable Care Act, efforts to bring down the price of prescription drugs, efforts to stop this administration's lawsuit, efforts to stop this administration's sabotage. You are a hero to those who prioritize health care in their lives. And you're a hero to those who believe that health care is the issue that's going to drive this election. So we are so honored to have you, and I would just like to give you the floor.
Thank you very much, Brad, for your very kind words, which I accept on behalf of my colleagues in the House, the Democratic members, with all the courage that they had to be supportive of the Affordable Care Act, to resist over and over again the scores of times the Republicans have tried to dismantle it one way or another, in ways that seemed appealing back home because they would make it sound good, but our members knew the truth. And the truth is that the Affordable Care Act makes a big difference in the lives of American people, and we want to do more. I want to just commend Protect Our Care for all that you have done over time to create and to protect the Affordable Care Act. Adam Hoyer, as you mentioned, on an almost weekly basis, briefs us on what you all are doing out there. But let me just say to our very important people here, Brad, with all the recognition to you and to Protect Our Care and Adam, your strength springs from the people who tell their stories. Marcus Castillo, I look forward to your story. Leela Waller, thank you for being with us. Laura Packard, thank you, thank you, thank you. And to Donna Marie Woodson, everyone who cares about the health and well being of their families is indebted to you for your courage to come forward and tell your story. Just to put it in the context, when we passed the Affordable Care Act, we would never been able to do it just by our inside maneuvering legislatively. That was important. But the outside mobilization of people coming forward with their stories and showing the need, and again, uh, spreading the word made it possible for us. When it was under siege in the Republican administration, all of you saved the day. 10,000 events across the country, not politicians speechifying, but people telling their stories. The strength of your stories. That was what created an atmosphere in which we would prevail and we would win. You all made that happen. And so, when we passed the bill, it was important for us to to make sure that 20 more million people would have access to health care, but that 125 million more families with pre-existing condition would have protection, and that all families, whether they had private health insurance or whatever, had a better benefit package for lower cost and higher quality. So everybody was affected by it in a very positive way. So then in 2000, when you see the other side came, oh, they just made up stories. It was awful. But then in 2018, we won the election. It was a healthcare election. It was a healthcare election, as was mentioned, and Brad mentioned it earlier. And why? And the press said to me, "How come this became a healthcare election?" It's because we made our own environment. This was the issue at the kitchen table of America's families. Would they be able to have access to health care? Would they be prevented because of a pre existing condition? Would it be affordable to them? And how did it impact their financial health as well as their physical health? It was important to America's families. Therefore, we made our own environment to make it a healthcare election, but we could not have done it without 10,000 events across the country protecting the Affordable Care Act. And so here we are again. Brad mentioned about the courts taking this up next week. The president was in a hurry to appoint somebody to the court, somebody who had criticized, written criticism of the Chief Justice for voting in favor of the Affordable Care Act when that came. A person who, when was asked by Senator Feinstein if she thought that Medicare was constitutional, she said she really couldn't say. She really couldn't say. So, to our friends on the call and to especially our special VIPs, our presenters today, understand that the reason this is a problem is the Republicans do not believe in science. They don't believe in science when it comes to climate change. They don't believe in science. So in terms of science, they're they are in denial. You see that with this pandemic, that they refuse to accept the reality of this, of what we need to do to stop the pandemic. And they don't believe in governance. They don't want to see any public role in healthcare in our country. Anti-science, anti-public role, anti-governance, and you have this. Plus in the pocket of the special interest in our country and not there for the people's interest in our country. So that brings us here today, a day before the election, which is even more of a healthcare election. Vote your health. That's what Brad taught us. Vote your health. You vote your health as people did in 2018, even more so in terms of a pandemic where the White House is ignoring the science and disdaining uh, the, um, the government role. So with that, I thank you. I thank Marcos and Laura and Leela and Donna Marie for sharing their stories with us. We're all very eager to hear them. I just want you to know how much we appreciate your generosity of spirit to tell your story and how grateful we all are to you for doing so. So thank you, Brad. I yield back.
Madam Speaker, thank you. And I'm so thrilled that you're here to hear from these storytellers who are doing so much in their communities to lift this issue up, to lift up the importance of this issue in the election, to turn voters out, which is really the most important thing we can do right now to protect our health care. So I'd like to start with Marcos Castillo from Arizona. And I want each one of you, Marcos, and then we'll go to you, Laura, and then down the line, just spend a couple minutes telling the speaker and our audience how important this election is for your health care. So a couple minutes on your story, and then each of your stories, and then we'll engage in a little bit of discussion, and then see if we have any questions from people who are watching or from the press. So Marcus, I'm not going to tell your story. You can tell it effectively for yourself. But what's on the line for you in this election tomorrow?
Well, the election tomorrow, without being hyperbolic, to me is like you guys said, it's a healthcare election. It's it for me as a person with and an autoimmune disease. It and an immigrant background. Also, we understand that the economy and your health are tied together. You have a symbiotic relationship. You can't have one prosper without the other. Coming from a lower income community, I've always understood that without my health, I can't do even jobs that one would consider simple, like digging a ditch or working in the fields or of that sort. So it's our community is feeling the pressure. I'm definitely feeling the pressure, and the intersection between my disability and my Latino background are really kind of shining the light. As far as my background, like I said, I'm from Yuma, Arizona, little border town in Arizona. My family were migrant workers. I grew up in public housing. I remember what old food stamps feels like. So the Affordable Care Act to me is a tool that helps elevate people out of poverty. It's one of many tools that we as Americans have at our disposal. And to think that next week it could possibly be struck down really puts a lot of fear in people in our community. So.
Marcos, thank you. And I think the speaker would agree with this, that, the Supreme Court is not immune to the political winds. And so the most important thing we can do between now and frankly November 10th, and then whenever the Supreme Court decides the future of this case, specious legally, no doubt. But when you get it to the Supreme Court, all bets are off. But the most important thing we can do is win an election that is on healthcare, and send a message to every single justice that you don't use some crazy specious legal argument to undo healthcare that is helping so many millions of people in the middle of a global pandemic. So thank you so much for what you do in the store and your story and telling it here today. Madam Speaker, I know you're familiar with Laura Packard. Laura, along with myself, is a co-chair of Healthcare Voter, but more importantly, she has been one of the most important storytellers during this period since Trump has been in office and trying to take away American healthcare. Laura was in Nevada in 2017, 2018. I think she single-handedly helped win that state for us in the 2018 elections, including defeating Dean Heller. who was a bootlicker, excuse my language, for Donald Trump on getting rid of the Affordable Care Act. She's in Colorado now, which is another key state where we're trying to reelect Jason Crow, and obviously win the Senate race there as well as the presidential race. Laura?
Thanks. My name is Laura Packard, and I'm a small business owner here in Denver. And 3 years ago, I walked into the doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. That should have been the hard part. But the day after my first chemotherapy, Republicans in the House voted to dismantle the Affordable Care Act, which was keeping me alive. So all through 2017, I would struggle through doctor's appointments, getting my chemotherapy every other week, and speak out, trying to get my senator to listen. He didn't, and he's no longer a senator. So I think it's more important than ever to listen to the people whose lives are at stake, because 135 million Americans have pre-existing conditions, and many of us are uninsurable without the Affordable Care Act. And we could die if we didn't have insurance. So every time Republicans in Congress and Trump talk about dismantling the Affordable Care Act, what they're saying is that millions of Americans would have to go without health care because it's more important to give tax breaks to billionaires than to make sure that every American gets the health care that they need. And their complete mismanagement of this pandemic leaves us trapped in our homes. My stepfather died last Sunday, and I can't be there with my mother right now because it's not safe. And that is Trump's administration's responsibility and fault.
Laura, thank you. And thank you for always telling your story, and obviously condolences to your family. I mean, I think that's this thing that's almost hard to wrap your head around, that the president and Republicans continue to target American health care, to target the Affordable Care Act, to target protections with people with pre-existing conditions. And they do it when we're going through so much pain and anxiety and loss with a pandemic that's been made worse by their failure to act, by playing down the virus, by not listening to the scientists. I mean, it is tremendously disheartening. But it's stories like yours and the rest that are going to show them the door and get us back on a better path. With that, I want to introduce Reverend Leah Waller, who is an advocate, a storyteller, and you, Reverend Waller, are in a state that is finally, for many of us that have been wanting it for a long time, is the center of the political universe. I mean, there's so much at stake in Georgia this cycle. 2 Senate races. We already have, a tremendous group of Congress people in that area. The White House winning the presidential race in Georgia is within reach, and it's because of people like you and stories like yours. So could you just tell the speaker a little bit about your story and what's at stake for you in this election?
Thank you. Good afternoon. Speaker Pelosi, I praise God for this opportunity and coming from the great state of Georgia, where we are looking to make our Representative John Lewis proud by turning it blue once again. Amen. I would like to say I was minding my own business. We're in the middle of a pandemic, but I was minding my own business, having some lunch with a veteran friend. And of course, he had a cold, but we thought it was a cold. But I was exposed at that time to the coronavirus. And since then, we have lost him. A week later, he died. And the week later, I was placed into the hospital, calling 911. Stayed in the hospital for 3 weeks. I had a stroke due to the coronavirus. I could not walk. I had to have physical therapy come in for over 3 weeks. I'm still not 100%, but I am moving forward. As I lay there in the hospital, I could hear moans and groans from those with the coronavirus. And I said to myself about healthcare, how many of them were suffering from not having healthcare and having healthcare. Let me be real with you, because I had a good job. I retired and I had insurance. It was at that moment when I really started. I've known all along about the affordable health care. However, I began to think and to read and to research, because as a pastor, as a minister, we have not been uh, serving our serving our congregations and talking about health care enough. And um, my I don't believe that we can have a quality of life without health care. And so we can shout, we can praise God, we can do the things, but if our health is not good, then we're not able to do that on an excellent level. We're not able to live on an excellent level. I don't know where this coronavirus event or experience is going to lead me. I just found out 5 years ago that I had type 1 diabetes. Usually that's something someone live with, born with. However, I don't know where this is going to lead. We're in the middle of a pandemic, and healthcare is truly, truly important to all Americans. So I thank you for this time, and we continue to advocate for healthcare.
Reverend Waller, thank you, and thank you for your advocacy. And last, but certainly not least, because she is from my native state of North Carolina, I want to introduce Donna Marie Woodson. Donna Marie is a cancer survivor who relies on the Affordable Care Act's protections for people with pre-existing conditions. And by the way, before you get started, Donna Marie, you know, the one place you can tell Republicans are on the defensive on the politics of the Affordable Care Act, which is more popular than ever, is that they run around, the president including, saying, well, no matter what happens with the court, or no matter how much we sabotage the Affordable Care Act, will protect people with pre-existing conditions. It's not true. They have no mechanism for doing it. The law that Speaker Pelosi passed is the gold standard for protecting people with pre-existing conditions. Insurance companies won't do it without the complex set of laws that are and regulations that are part of the Affordable Care Act. And for them to say otherwise, that they would protect people with pre-existing conditions while trying to invalidate the Affordable Care Act, is the lie of the century. But with that, Donna Marie, let's please tell Speaker Pelosi what's at stake for you in this election.
Listening to everyone's stories, no matter how many times I talk to people and I hear what they've gone through, I feel even more blessed in my situation, because the Affordable Care Act literally saved my life. My family got caught up in the 2008 recession, and my husband lost his corporate position, and we lost our health care. And so I went for a few years without any insurance, not because I was negligent, but because I didn't have insurance and I knew I didn't have the money to cover the cost. But I'd been healthy all my life. So I was like, I can wait a little bit and something will turn up. So when the Affordable Care Act became available, my husband and I immediately signed up for it because we were qualified for it. And thank God for that, because then I scheduled my appointments to get back on track, because I was always very good with keeping up with mammograms, and I'd already had previously a colonoscopy, and everything's always been like just perfect, nothing wrong. So I went in for my colonoscopy, and even before I could leave the building after the procedure, my doctor said that he was 99.9% that I'm sure that I had colon cancer, which knocked me for a loop, because like I said, I'd always been healthy, and this was not anything that I ever expected to hear. I always think it happens to somebody else, but in preparation for the surgery, they did a full body CT scan and saw something in my breast area, but they said, we need to do the surgery first, because it was stage 3 colon cancer. And so we did the surgery. I recuperated for about a month, and then my doctor said, you need to have a biopsy, which I did, and it was cancer. And the crazy thing is the two were not related to one another. The colon didn't cause the breast cancer didn't cause the colon cancer. And my oncologist was like, this is extremely rare. So I'm telling you, without the Affordable Care Act, I wouldn't be here. I would not be here sharing my story or being able to be a voice for people who don't necessarily have a voice, to talk to legislators and press upon them. We're not just a number. We're people, we're humans, and you don't know what something's going to happen to you. I didn't. I would never have said, oh, well, maybe it's a possibility. No one knows. We're all human beings, and that's what we all have in common. That one day we're all going to die. We do not get to stay here, so I don't know how you're going to go out. I don't know how I'm going to go out. But to deal with people like there's something else, like there's some other thing, is just incorrigible to me. It's just unfathomable. And to try to rip healthcare away while lying in our face about, oh, there's a plan. There's not a plan. If there was a plan, we'd have seen the plan. There's no plan. Please stop lying to the American people. Please stop having ads on TV about how VP Biden's plan for healthcare is going to close hospitals. No, not expanding Medicaid closes hospitals. Not having people have healthcare. So they're going to the emergency room. Those are the issues, the true issues. And I will continue to tell my story, because this is imperative for every American to understand. All of us deserve to have healthcare. All of us. It's not a luxury, it's a necessity. And this is truly the election. It's a live or die. It's a live or die election.
Oh gosh, Donna Marie, thank you so much. Thank you for your story, and thank you for your passion. It is a life and death issue for so many people. And the thing that I think of is, what if Tom Tillis, the senator from your state who's up for re-election, or Cory Gardner, or Martha McSally, or David Perdue in Georgia? I mean, what if they sat here through this Zoom and heard your stories? Madam Speaker, what would they have to say? What would they have to say? The fact is they have very little to say on the substance. Their opposition, I've never quite figured it out. It's ideological, it's political, but it's wrong-headed when so many people are benefiting. Donna Marie, thank you, and thank you to Laura, Marcos, Reverend Waller. I want to turn the floor back over to Speaker Pelosi to reflect a little bit on what you've heard, and then we'll see if there are any questions from our town hall participants or the press.
Thank you very much, Brad. Lauren, Donna Marie, and Leila and Marcos were further proof that the most eloquent spokespersons for the Affordable Care Act are you with your personal stories. I'm glad, Laura, that you're in good health now. Donna Marie, it really, you said it so clearly. They don't have a plan. Leila, you talked from the standpoint specifically also of the pandemic. Then we have a plan for that. And Marcos, autoimmune, so many people in our country are affected by your diagnosis as well. So all of you have spoken to and for many people in our country. But on the pre-existing condition, because this is, as has been said, they are not telling the truth. They are telling the truth in this respect. You can have coverage for a pre-existing condition. It won't be a barrier to, if you have endless money to pay for it. You'd have to be among the richest people in America to be able to afford what will, and for whatever period of time it is. So when they say that, what they're not saying is, yeah, you'll have coverage. You won't be able to afford it, but you'll have coverage. And we'll make sure that you have coverage that benefits the insurance company at the expense of your health and your family's health. So again, when I just tell you this story, when we were passing the bill, they said to me, well, it doesn't look like you're going to be able to pass it. No, we're going to pass it. We're going to pass it. This is an opportunity of a generation for us to pass this, Laura, Donna, Marie, Leela, and Marcos. And they said, well, how are you going to do it? It looks like it's going to be very hard. And I said, well, there's nothing going to stand in our way. Brad's heard me tell this story a million times. If there's a barrier in front of us, we're going to push it our way through it. We're going to just push our way through the gate. Otherwise, we're going to climb over the gate. If that doesn't work, we're going to pole vault in. And if that doesn't work, we're going to parachute in. But nothing is going to keep us from passing the Affordable Care Act for this generation. This is our opportunity. For 100 years, presidents have tried and Congresses have tried and not succeed. So after, and they said, oh, blah, blah, blah. So after it was over, they came to me and they said, which one did you do? And I said, well, we pushed open the gate. The first thing, we pushed open the gate. But it wasn't just us. It was all of the people with their diagnosis, which they're concerned for their families. The nuns, the sisters, they were a savior to us, literally, figuratively, in every way. It was Protect Our Care. It was all of the grassroots organization. It was the those who are diagnosed with every possible diagnosis that you can imagine, all getting behind us to push open that gate. You made it happen to begin with. You saved it from the Republican, now Republican repeal again and again, and now with the court. So understand this election is important. We win the House, the Senate, and the White House. We will overcome whatever the Senate strives to do. But if they do it, I've said to the Republicans, every election for you is going to look like 2018 because the public will never forgive you taking away their benefits. And I can't help but thinking when Donna Marie is telling her story of the fact that early intervention would have prevented so much of what you went through and the others of you as well.
Right.
And that can only happen if you have the free, if you have preventive care, if you have the free exam and the rest of that. If you had an earlier exam, Donna Marie, you might not have had either of those develop to a place that challenge you personally so much. So thank you all. You are just remarkable. Your stories are so eloquent and so moving, and we cannot succeed with the courage to tell them.
Well, thank you, Speaker Pelosi. And before we go to questions from the press, I just want to remind people that it's not just what's at stake. It's like sending a message to the Supreme Court. It's stopping President Trump from continuing to sabotage and try to repeal the Affordable Care Act in the event that he got reelected. It's not just trying to stop, but it's all the things, Speaker Pelosi, that you want to fight for, that you've committed to fighting for in the next Congress. It's the enhancement bill that you passed and that Mitch McConnell let sit in a legislative graveyard. It's HR 3 to provide the power to Medicare to negotiate to lower the price of prescription drugs. And your bill was so tremendous because not only did it did that, it invested in enhancing Medicare for seniors. You've talked often about the public option, a provision that that Vice President Biden supports. And so your commitment, I mean, it's the opportunity to make healthcare even so much better than it is now. So it's not just the negative opportunity, stop bad things from happening, but we have an opportunity to provide more affordable healthcare to more people at a better price and to lower the price of prescription drugs. And with you back in the speaker's chair, with Vice President Biden as president, and with a Democratic Senate, by God, we're going to do all those things that you've talked about doing.
Thank you.
With that, I know everyone's short on time. Mitch, let's line people up for questions and
As
see
you
how that.
said, I just want to say that
Yeah.
it's important that we win the Senate, and Arizona, Colorado, Georgia, and North Carolina are very important in that.
Oh my God.
In
They
those,
really are.
it's a matter of life and death.
It really
We're
is.
here in Arizona, we're trying.
Yeah. Thank you.
Marcos.
One day to go. One day to go. Mitch, tell us how we're going to take questions.
Yeah, so if our reporters, they can see a raise your hand feature. If you have any questions for Speaker Pelosi or any of our other speakers today, just raise your hand and I will call on you. Okay, so our first question is going to be from Mary Ellen McIntyre at Roll Call. Mary Ellen, you're live.
Thanks, Mitch. Speaker Pelosi, my question's for you. I'm wondering what sort of legislation you're considering bringing up if the Supreme Court does strike down all or some of Obamacare. Would it be similar to existing legislation that the House has voted on this year, or forthcoming more targeted legislation to address whatever part of the law the Supreme Court might strike down?
Thank you, Marilyn, for your question. I think Brad anticipated what he had to say because we did in the summer, we passed our Enhanced Affordable Care Act legislation, which gives you a clue to how we want to improve the legislation. We also passed H.R. 3 a while back to lower the cost of prescription drugs, because that is the only place in the Affordable Care Act that we could not get the ability for the secretary to negotiate for lower prices, which would take the curve down in terms of rising cost of healthcare. And we would, I always wanted a public option. I couldn't win that fight in the first Affordable Care Act, but the president, Biden, is advocating for it, and I think they'll be supporting this. So it would be an Enhanced Affordable Care Act. And those are just some aspects of it. I don't, until we see what the court does, they're having their own argument about severability. If you strike down one, does the whole bill come down, or or can you take it in pieces? We'll see. But one thing is for sure, we will be ready.
Thank you, Madam Speaker. Mitch, other questions?
Yep, so our next question is going to come from Alex Ruoff at Bloomberg. Okay, Alex, you should be live.
Yeah, thanks for taking the time. This is also for Speaker Pelosi. You laid out a pretty robust healthcare agenda here, and I'm wondering if you have a sense for, if things go, Democrats' way. It's very unlikely Democrats will have 60 votes in the Senate. Do you have a sense for how you make a lot of this law? Do you think this has to be some bipartisan agreement that gets a lot of this together, or do you envision maybe like a reconciliation effort to try to take this along those lines? Do you have a sense for how you get, an agenda this large to become into law, how you kind of, take that big lift?
Well, one thing at a time. Tomorrow we have to win the election, and that's very important. And we're all working very hard in that regard, because it is a life and death election. Everyone's health is on the line, on the ballot tomorrow. The latter, reconciliation. We passed the Affordable Care Act under reconciliation when we did before, because we therefore didn't need to have 60 votes. It is a budget bill. It is consistent with the rules of the House and the Senate that you can pass a bill under reconciliation, which means it has to be reconciled with the budget. And we most certainly will be passing a reconciliation bill, not only for the Affordable Care Act, but for what we may want to do further on the pandemic and some other issues that relate to the well-being of the American people. Our agenda in 18 and now still, for the people, we're going to lower the cost of healthcare by lowering the cost of prescription drugs, preserving the pre-existing conditions, et cetera. For the people, we're going to not only lower healthcare, but bigger paychecks by building the infrastructure of America in a green way. And for the people, we're going to have cleaner government. That still remains the framework under which we will operate, under the infrastructure, its workforce development, things like that, but also under cleaner government. That will be HR 1 once again. to enhance the voice of the people, to have the people's interest determine policy, not the special interest, big, dark special interest money. And so, yes, we go the reconciliation route. We always would hope to have bipartisanship. That is always a goal that we have. And if we have that, that would be great. But if we don't, we're not going to count on that.
Great. Thank you. Mitch, do we have other questions quickly?
I think that's it for today, Brad.
Well, thank you, Madam Speaker. I want to thank you. I know you're so busy, and to be doing this with us on the last day before people cast their final votes, it means so much to us. I know it means so much to our storytellers, to Laura, to Donna Marie, to Marcos, to Reverend Waller, and I feel very confident that one, we're going to expand your majority. And that is a testament to the work that you and your colleagues have done. A lot of people said, well, there's just no way, right? I mean, that was such a big victory in 2018. It's got to contract some. I've predicted, I'm not going to tell you the number, but I've predicted a pretty significant expansion of your majority. I believe we're going to win the Senate and the White House. And then we're going to improve American healthcare for the folks on this screen, for the folks watching, and for all of the American people. So again, I want to thank everybody. I want to thank you, Madam Speaker, and I'll just turn it to you if you want to say a final word.
Well, I want to say thank you to Protect Our Care, because you've made so many things possible, and to Adam Hoyer, yes, and to you, and also to our VIPs, our speakers today, Donna Marie, Reverend Waller, Laura, and of course to Marcos. I just say this: when we come together, we talked about what we are doing in the House and what we've done. When we come together, we'll be working with the President of the United States who shares our values. We'll have lots of new ideas coming from our members. So we'll put everything on the table and see what comes up the best for the people, whether it's for patients or also in terms of what it means financially and the rest. So it's going to be pretty exhilarating, and it's going to take us way down the road. We would never have been down that road if we hadn't passed Affordable Care Act to begin with, and now we'll grow it, and we wouldn't have saved it without the storytelling, most eloquent, convincing, persuasive part of it all. So thank you again to our special guests who made this special occasion possible, and thank you to Protect Our Care, and thank you, Brad Woodhouse. You have been for such a long time.
Well, I want to thank you for your kind words. I would be remiss. I know I said to let you have the last word, but I'd be remiss if I didn't mention the heart and soul of Protect Our Care is Leslie Dock, who founded this organization so long ago. He's the embodiment of the passion, the strategy, the energy. We have a tremendous team. Ann Schaup, our communications director, Rebecca Parks, our research director. We have a whole team that's been working on, led by Zach Petcanis, who has done our coronavirus work and has held this president accountable as you have. And I just, all of us working together, I think is going to result in a good result tomorrow. But at this moment, we're going to hang this call up, and we're all going to do everything we can to turn out the vote and to win tomorrow. So thanks again to everybody. And as always, thank you, Madam Speaker.
And thank Leslie and the entire staff.
Great.
Thank you.
Thanks, everybody.